Alright, what we're going to be doing is going to be doing a dressing change on a triple lumen catheter. I will talk to you briefly about the PICC line, but I'm actually going to do the dressing change on the triple lumen catheter. You need to make sure that you're able to, that you're going to get all of your supplies, which is going to be one flush for each line. 1, 2, 3. You will also need a bowel patch. And you will need a kit. CVP dressing kit. That's what you're going to need in order to do this. I told you that I will be talking to you about the PICC line. The additional thing that you may have with a PICC line is a stay lock, and that will go on the PICC line. But the only I'm only going to show you the dressing change on one. The principle is the same. So what are you going to do? You're going to go in, you're going to introduce yourself to your patient. My name is Lee. I'm going to be your nurse today, and I'm going to be and I have to change your dressing on your triple lumen catheter. Okay. And what I need for you to do is to just remain still as I'm doing that and turn your head the other way. Once we get into the procedure, I'm going to have you to put on a mask, and I want to put on a mask too, just to help keep down the chance of getting an infection. So, you're going to verify that you're talking to the patient. How are you? My name is Robert Davis, and your date of birth 3/25/48. And you're comparing that to whatever legal form that you have, in this case, the chart. So, you got your supplies. So you're going to set up the area that you're going to be working with. You need a trash can. So you're going to clean your hands. And you're going to put on clean gloves, and you will remove the old dressing. You clean your hands, put on clean gloves, and the reason that you will be taking this off is that they are sore, or the fact that the time has elapsed in order for you to change it, to make sure that you're in accordance with the hospital policy. Typically that's every 7 days. So take it off, peel it back. You're going to always pull in the direction of the insertion site. And as you're pulling, you're going to check the catheter length so that you don't, make sure you don't have any migration. So, you pull it, pull it, pull it. And if you notice, I am pulling towards the center, but I'm not pulling down yet until I've gotten everything, so there'll be one easy motion to come out. As a matter of fact, I have my finger on the triangular set there. Alright, so now I have it. I'm pulling this up from the skin, but I'm not tugging on the catheter itself. So I'm checking. As I'm checking, I am making sure that that doesn't flow upward. The catheter doesn't migrate. Alright. Now, show you what I'm talking about with the marks on there. You see those little marks right there? Those are the marks that I was telling you that would tell you where that catheter site should be. But since it was already all the way there, that's what you're going to be held accountable for, wherever it was when you got started. When you take this off, do not throw away my precious little bio patch. Alright, so now you have it, you have the site exposed. We're going to change gloves again and wash your hands. You're going to get your tools that you're going to need in order to do this, which will include, in this particular case, a mask for you and the patient, and 3 flushes, bio patch, and like I told you, I always take at least 2 pairs of sterile gloves because you never know what's going to happen. So, I'm beginning to open up my kit. I'm going to wash my hands, and I would put on gloves, but you saw what happened the last time I tried to put on the gloves, so to make this move along smoothly, I'm not going to put gloves on right now. So, I'm going to open up the kit. Once again, I'm doing it carefully so that I don't spill my contents out all over the place. Okay, now I have that done. I can open my bio patch up and I can put it onto my site. One thing that we should have done prior to, and that we should have checked the patency to make sure everything was good there before we took it out. Because if all of those are not flushing correctly, then we have a problem and that line isn't working. So, if you did this and got to this particular point, it's not going to be a pass or fail thing, because remember what I told you about self-correcting? That's what you would do. In this particular case, I need to go ahead and take care of my site now, because then I will worry about changing that if it was flushable or not. But you want to check for patency before you remove your dressing. Alright, so at this particular point, I am going to open up my gloves. Sterile gloves. Alright. I can work from within my kit, or I can transfer it over to my sterile glove case, whichever way is comfortable for you. Get rid of the mask. Don't need it. Get rid of the glove. Don't need them. Not going to worry about this. I need the tape, but I'm going to put it over there out of the way. And voila. So I got what I need. I'm going to take my chlorhexidine prep, click it, and I am going to contaminate one hand now, because now I'm going to grab the dirty end here, and I'm going to come and I'm going to start cleansing this area here. In this particular case, I'm cleansing in a circular rotation around and out. Then I'm going to clean upward on the top, and on the bottom side I'm going to clean upward as well. I'm going to let that drop, get rid of this, and now I will use my clean hand, my sterile hand still, get my bowel patch, use my Pac-Man-like abilities, and press it on. Remember, I told you that this particular point there will be maybe some contact with the Lumen catheter itself, like on the edge there. But you're still on the top side of that. You're not on the bottom side, which is the reason that it's not a real big deal. Once again, you get your dressing change, pull it open for your tegaderm, and you're going to center it like so. Press down, bring your ends through, bring it over to close the hole as much as possible. You get an overlap there. Then you're going to flatten it out. Now, the small chest that we have on Mr. Davis here leads for some problem because some of it folds over on his back. And that's not a big deal. Not for you passing SPD. Smooth it out. A little Pac-Man thing. Open up a little bit. But I'm not going to open that back up to close that. I see it, and it is surrounding the entrance there. Pretty much should be completely closed up. So now, I have everything all flattened out. I have the ability to go ahead and date. An initial and place it at some point that it does not occlude the visibility. Here's the reason why you needed to flush first. Because now, if I am flushing each of these, and it's going to be with the same. I left my alcohol swabs. You're going to need alcohol swabs for each one of those. So, you're going to vigorously scrub each one for at least 20 seconds. Get rid of it. Let it dry. Attach it. Open up your clamp. You're going to aspirate, and then you will begin to slowly infuse. If you meet resistance, it says that you got a clot or something, blood or something is there. So if that's the case, you won't be able to vigorously flush it through. You begin to go ahead and to continuously press. Once you got in 2, then you go ahead and press the remaining 4 or 5 milliliters of saline in and clamp it off while you're doing so. You will repeat that with each of your catheter tips until you have completely flushed each one of those, and then you will go and you will document. Okay, so that is the basics of the doing a dressing change on the triple lumen. The big difference between the two is the fact that with the PICC lad, you have a stay lock that is holding that. Same process. When you open up everything, if you was doing the PICC lad, you would open it up and drop it into your sterile field. Like that one didn't work so well, but you would drop it into your sterile field. If you're doing it with the instructor would help you with each one of those. You would have to, when you're changing your dressing, remember about the alcohol that you're going to need in order to get the dressing off. You've got to open your alcohol swab up, come up under the edge of your stay lock, and slowly saturate that with alcohol until you're able to peel it back. Remember, this is the equivalent of supergluing something to the individual skin. So if you rip that off, like I said, somebody's going to fight you. Once you have gone through the cleansing process, now you can take your stay lock. You have the barrel patch on. You'll put the stay lock down, and now you can insert these 2 little holes there. They're on each of them, into those 2 little holes, those little prongs there, and you will close it up like so until they snap, and they will just snap right on in there. I don't want to lock it down, but that's what would happen. It would lock in, and it would be like that. It would give it a very secure holding. Once you have everything in place, then you put your dressing on. Remember, this part of it will be sterile, just like when you were here, that was sterile too. Okay.